Here at Iowa, we have been fortunate to be able to have a number of experts that have allowed us to cohese together into a service we call the Renal Genetics Clinic. It's one of the few centers in the country that has a fully functional renal genetics clinic staffed by adult nephrologists, pediatric nephrologists, and by a renal genetic counselor. Genetic testing has come of age at a time when nephrologists and internists are not yet comfortable with the role and limitations of genetic testing. And we believe that today's nephrologists and nephrology trainees ought to be exposed to practical aspects of renal genetics, and we are able to offer that here at Iowa. So the one-year-long fellowship that we have been approved for, I believe, is the first in the country. This is a multidisciplinary fellowship that pulls in not just pediatric nephrologists and adult nephrologists, and that includes myself as the director of the Renal Genetics Clinic, Dr. Lama Noruddin, who is the director of the PKD, or the Polycystic Kidney Disease Center of Excellence, Dr. Carla Nestor, who is the director of the Rare Renal Disease Clinic and runs the atypical HUS and 3-3 glomerulonephritis clinics, and Dr. Meenakshi Sambaria, who is the director of the Renal Stone Clinic. In addition, the fellows who come to this fellowship will have the opportunity to rotate with faculty in genetics, including in the metabolic clinics and in the newborn clinics. This will allow fellows to get a broad exposure to all aspects of genetic medicine and not just focus on testing for genetic kidney diseases. One of the other unique aspects of Iowa is that we were the first in the country to develop a comprehensive renal gene panel called KidneySeq that allows the nephrologist to interrogate in an unbiased fashion any patient with kidney disease for every known Mendelian genetic kidney disease. We have a comprehensive renal gene panel, and we have focused renal gene panels that are phenotype limited. The other unique aspect of Iowa is that we are a center of excellence for atypical HUS and C3 glomerulonephritis. We have a clinically approved, CLIA certified testing capability for complement renal genes and functional complement testing. And fellowship candidates can not only spend time in the clinical setting in the clinic, but can also rotate through the laboratory where we discussed genetic test results and help refine the genetic test report.